Yeah, sure. So from a Microsoft point of view, my name's Rob Heath. I'm an account manager in the health team. We've got Phil Rowlands, who's an account technology strategist, and Phil Bonnet, who is also an account technology strategist.
And then there is myself, who is the lead trainer for the Northern team in EMIS Health.
Hi, and I'm Ed Bellamy. I'm Chief Commercial Officer at EMIS Health.
Lovely. So, Phil, you put in these slides up. Fantastic. Okay, so we've done intros already, so we can move on from there, Phil. So, quick overview of what we're talking around today. So, we'll be talking around Microsoft's healthcare strategy, all up. So, a quick 5 minutes on that. We'll reference the recently signed NHS Office 365 deal that was signed back in June. So, just a quick minute on there. And then we'll go into use cases around Teams and Office 365 with a demonstration that'll be run by Phil Barnett, and then there'll be time for Q&As after that. So Phil, if you can move on, please. So Microsoft's mission, we always start off with this when we talk around our approach to healthcare. And actually, I watched a video a week back where Bill Gates was talking very early on in the 80s when he said Microsoft's strategy can be defined in one word: Windows. And if you think how far we've come since then, almost 40 years now, our mission has evolved significantly. We now focus towards empowering every person, every organisation on the planet to achieve more. It's on every staff member's ID card, and it's ingrained in everything that we do on a daily basis. And if you look at the way we showed up during COVID, and specifically in how we supported the NHS, never has that been more true. So looking at how we deployed Teams to 1.2 million people in such a quick space of time, and then to enable through Windows Virtual Desktop the access to clinical systems remotely, where clinicians were able to work fully accessing APRs and like without having to be in the hospital. And then through HoloLens, how we changed the experience of a patient engaging with a clinician, and also then how we protected frontline workers in the way that they engaged. When we talk around digital transformation, and back to that comment around Microsoft, starting off with Windows being the core of everything that we do, to right now where we have 3 clouds that we focus on continually. So from a modern workplace point of view, how we create more personal computing, how we use a Dynamics platform to change business processes and productivity, and then through Azure, how we have an intelligent cloud platform to enable people to build intelligent solutions and change the way that they work. So Phil, if you can move on, please. From a healthcare point of view, we focus around 4 specific pillars. So how we enable healthcare workers to engage with patients. So I mentioned HoloLens there, which is an opportunity to use holographic images. So we see patients working with clinicians so they can visualize procedures in real life in front of them and actually see what's going to happen to them. Empowering care teams and the way that they work with the tools that they have to become more effective. So a project called InnerEye, where we take MRI scans where radiographers are able to look at individual slides and administer radiation treatment or radio treatment through computer algorithms, and using AI to be able to speed up what they do significantly. From clinical effectiveness, RPA, so robotic process automation, is significantly changing the speed that things are done in the back end of a hospital. And then looking at how we transform health, so using things like IoT to ensure that only the health as the sickest patients are actually in a hospital setting, and we're able to use remote sensors and things like that to measure and monitor how patients' health progresses when they're external to the hospital. Phil, if you can move on, please. So probably the worst kept secret around Microsoft and NHS Digital is that we spent a long period of time in discussion looking at a central deal for Office 365. Does that slide move? Thanks, Phil. So the great news, the deal was signed back in June, and this now provides Office 365 to around about 1.2 million NHS staff across England. I'm not going to go into massive detail. Hopefully by now your Microsoft account teams, your licensing specialists and your colleagues NHS Digital have shared how you can access the scheme. but it provides significant discount to what is the premium productivity suite within the Microsoft portfolio, with enhanced security layers across the way. If you need to find more information out, then feel free to get in touch with, as I say, your licensing specialist, your Microsoft account team, or indeed direct to NHS Digital. So I'll hand over to Phil, who's going to walk you through an overview of what's in the Office 365 suite and also part of Teams.
Thanks, Rob. For those not familiar with Microsoft Office 365, the technologies span a number of productivity categories. If we start from the left, we have authoring, which is made up of the usual Word, Excel, PowerPoint and OneNote. With mail and social, we have Outlook, which is used for collaborating in the familiar environment of email, and Yammer, which is more of an organisation-wide opportunity for employees, management to be able to connect with each other. SharePoint and OneDrive. So SharePoint keeps content at the centre of teamwork, making all types of content easily shareable and accessible. It has tight integration with Outlook, Yammer and Teams, and enables seamless content collaboration. And with OneDrive for Business, you're able to securely store your own personal and private files, but you're able then to share them as you wish and control who has access to them, but again in a safe, secure manner. I'll gloss over chat and calls and meetings at the moment, and we'll just touch on analytics. So users with analytics, basically you're able to kind of get insights through AI to help you manage your productivity and be able to kind of set aside time for insights or be able to chase up and to-dos and etc. And underpinning all that, you've got the advanced security and compliance in order to make sure that all the work that you do is maintained and secured within the confines of your organisation in a safe manner. So if we focus on Teams specifically, Teams is really to think about it as a hub for Microsoft in terms of it's where people yourselves would, including people outside your organisation, can actively connect and collaborate in real time to get things done. So to think about Teams as a place to actually have your private and informal chats, whether it be through text, audio, video or file sharing. You can co-author documents as well. But you might also be working together in other apps and services. So if we take a look at some of the sort of Microsoft Teams sort of use cases that we have, and I'll just pick out a few of these. So I'll focus on one which we call shift management. Shifts lets first-time workers, maybe could be a community nurse or other people in the organisations, to use their mobile devices to manage schedules and keep in touch. So a person can create, update and manage shift schedules. They can send messages to one person or the entire team, and they can also send documents, news bulletins and videos. And employees can also then view those upcoming shifts. They can see who else is scheduled to work that day, request to swap or offer a shift, and can request time off. And if we look at federated messaging, sometimes referred to as external access, this can be useful when you want to maybe engage with someone externally, users in another domain, to find a call and chat with them and engage in a meeting. And as well as the things that the features that we already exist in Teams, there's already news and announcements of new features which are emerging, and here are just a few of those in terms of what exists today, in terms of either on the roadmap or have just been released or will be released shortly. So you have things like the video gallery, the opportunity to look at and view all participants on a 7x7, so that will allow 49 participants to be viewed on a single screen. You have the dynamic view, which enables through AI to basically organize how you and who you can actually see on the screen. You're able to organize that yourself through pinning or allowing it to kind of focus and work out the best and optimal view for your particular circumstances. And one that's kind of been talked about is a together mode. This is a new sort of meeting experience which has been announced, which again uses AI segmentation technology to digitally place participants in a shared background, giving the impression and feel as though you're in the same room with everyone else. Underpinning all of the technology that I just touched on very briefly is it's important to stress and overemphasize the importance of trust around this in terms of people's data and privacy. This is really at the heart of everything that we're doing within Microsoft. Protecting people's data is something that we take very seriously. And as the quote from Brad Smith says there, people will only trust you in use of technology if we can use it in a trustworthy way. And that's part of the trustworthy approach that Microsoft takes. And backing that up, we also have what we call our certifications and compliance agreements. These are growing all the time, but again, emphasize the importance that we place on the principles around privacy and how we actually manage data from a user's perspective in order to remain compliant and in accordance with whatever the regulations are for that particular country. So I'll hand over now to Phil to start the demonstration. Over to you, Phil.
Thank you very much. I'm just sharing my screen. Okay. So on screen, as you can see at the moment, this is the main portal to Microsoft Teams. I am using the web browser version, but the desktop version looks identical to what you can see on screen at the moment. Down the left hand side, you'll notice we've got some navigation sections. We've got activity, chat, Teams, calendar, calls and files. Just briefly going through these, activity is where you'll get all the information coming in that is got to be relevant to you. So if someone mentions you or if someone does something that wants to talk to you, it will come up in your feed. Chat is for one-to-one chats between you and a colleague. So it'll allow you to have that one-to-one brief conversation without having to pick up the phone or having to talk to someone about something. We'll just skip over Teams a minute and I'll go back to that in a second. Calendar is where this synchronizes with your email Exchange calendar, allowing it to pull through into Microsoft Teams and allowing you to actually schedule Teams meetings from within your own calendar. Dependent on your licensing, you can also have calls, which allows you to make external phone calls through Teams using a PBX as well. And finally, files. What files does is files is a quick link to your OneDrive, allowing you to connect to your drive and allowing you to see your files within Teams. So the Teams button is where we will do most of our collaboration. As you can see here, I've already got a team. So what is a team? A team is an area that is designed for people to be able to collaborate. It's designed for more than a one-to-one conversation. It's designed for a selection. The easiest way to say this is if we take something like an MDT, for example. So to create a team, all you do is click join or create a team at the bottom corner. Click create team. Within here, it'll ask you how you want to create a team. In this case, I'm going to do it from blank. And it will ask you if you want a private, public team. Most organisations, you will not see the org-wide team. This is only for organisations that have had this enabled. In this case, I'm going to make a private team because I want to say who can be in it and who cannot be in it. Simply give it a name. You can give it a description if you want and click create. It takes a second to create a team and it will say well done, you've got a new team, and you can see it's appeared on the left hand side. From here you can decide who is a member of the team. In this case I'm going to add one of my colleagues and I click add. At this point I have a decision to make. At this point I can choose if they're a member or an owner. If they're a member of the team, that means they're part of the team, they can collaborate in the team and they can work with the team. If they are an owner of the team, this gives them privileges above that to allow them to add other people to the team as well. The other option you've got, if enabled, is to add a guest. So in this case, if I do this, you can see this person is outside of my tenant. They are not part of my organisation, but if I add them in, it will still add them in. What you'll see here is I do not have the option to change whether they are a member or an owner. They are always a guest. And there's rules around that you can put around that to say what a guest can and cannot do. Within there, you can see I've got a general channel. By default, every single team has a general channel. And from here, you've got posts and files. Posts are where you can have that chat. So you can see here, Phil has already said, thanks for adding me. I can reply to that. And if I want Phil to know I've replied to that and not just chat in the team, I can do the @ sign, a bit like on Twitter, and I can mention someone within the team. And that will allow me to do that. On the left hand side, I can also show recognition to show that actually I've read his post and that I like it, or you've got other ones in there as well. Along the bottom on here, if you want to make your post a little bit more fancy, you can click on this little button at the bottom and it'll allow you to add a subject and some more stuff. You can also click on it and make it an announcement. This will put a big headline on it. So when you post at that level, what you see is it actually posts it as, sorry, didn't put a message in. It will actually post it as a much bigger post than it did before. You have a few other options down here as well. You can attach files from your PC or from your OneDrive. You can add smiley faces in there. You can do GIFs. You can do lots of other little things as well. From this point, you can also create what's called a channel, a new channel. What a channel is it is a breakdown of stuff within the team. So in this case, you've got the general channel that's for everybody. Then you can have channels for individual stuff going on within that. So what you can do with a channel is you can have a standard channel, or you can have what's called a private channel, which I will create here. When you create a private channel, you'll see that on the left hand side, it gets a little padlock on it. I'm going to say I don't want any members added to that. So at the moment, there's only me as a member to that channel. And you can see it's got a little padlock on it to show that no one else can get in there. As the owner of that channel, I can go in and add members as before, and I can make the members can only be a subset of the people who are already in the team. And you can click them and add them. And as before, you can add them as a member or an owner of that individual private channel. The other thing you get in here is files. Files is where you can go into and you can actually upload files into there and you can all work on them collaboratively. So files is very much a single port to all of our productivity suite. You can click on this little add sign here as well, and within there you can see that there is more tabs available, and you can add tabs from our solutions and also from the hundreds of third-party solutions that Microsoft have partnered with. What this means is, rather than if you have an Excel document sat within your team, what it means is rather than going to that, you can actually click on Excel, pick that document and show it as a tab along the top. And I'll show you where I've done that on another one in a minute. What you can see here is within this one, this private channel has gone bold. The reason for this is because there's been a change in that channel. My guess is Phil has sent a message, which he has. When you saw that update, that was just because Phil had posted, so it wasn't necessarily to me, it was just posted. If Phil mentions me in a different channel, what will happen is I will get the bold comment, but I'll also get the number 1 around it to show I have 1 notification relating to me into that channel, and we should see that come through any second. As you can see, another message has come through with a number 1 on it. I've got a notification, and that's all because he's put the @ logo at the front of my name, meaning he wants to talk to me directly. What that also did was ping in that activity feed at the top where we were saying before, and you can click on that and it will take you back directly back to where you were. Taking this to an MDT's perspective, where we're talking about adding members and where we're talking about adding channels is where you would like to add your community nurses, where you would like to add anyone who's going to be part of that MDT into that channel. And there may be stuff you want to talk about within that MDT that's not for everyone who's going to attend the MDT, which is why you can make them private channels. In this one, what we've done here is we've created 2 tabs and we've created one called MDT Patient Portal. Now, if I then want to go into that channel and I want to create an MDT meeting, I can click on my calendar. I can click on new meeting at the top left hand side, and that'll bring up how to create a meeting. In this case, I'm going to put MDT scheduled meeting. I'm going to add Phil in there. Set the time for now, and then what I'm going to do is I'm actually going to add in that channel. So you can see MDT EMIS Live, MDT Portal, and you can put a description in there as well. When I send that, what will happen with this is I will see it appear in my calendar. I will also see that appear in my Outlook calendar, in my Outlook client. And also if I go back to the team, in MDT Patient Portal, you can see it has appeared here as well. At this point, I can click on that meeting and I can click join. I'm not going to let you use microphone or camera because I'm already in a meeting. Otherwise, you would normally allow that. At this point, it says MTD schedule meeting, join now. And you can go into the waiting room waiting for us to join. If Phil is to join this meeting as scheduled in the call, you will see him come into the meeting. There's a few options in here that allow you to do a bit more stuff. So if you click on the show conversation, what you can do is have a conversation about the meeting while you're in the meeting, which will be kept within that meeting. The other really cool feature that's come through recently is this little picture of a hand. So what the picture of a hand does is when you click on the picture of a hand, it puts your hand up within the meeting virtually. And what that actually does, Phil's just joined. What that actually does, if I click on here and click on the picture to show the participants in the meeting, not sure why it's done that. Not sure why it's done that. What that does is that puts my hand up in the meeting and says, I want to talk. What this does is stopping everyone coming off on mute and stopping everyone being able to do it at the same time. What you can also do in here is click on the share button. When you click on the share button, this allows you then to pick what you want to share from on your screen. So what I'm going to do is I'm going to get one of our colleagues to share their screen, Catherine, at this point where she will show you how we can then go into EMIS on a shared screen and allow everyone to see and do an MDT in EMIS in a shared MDT virtual meeting.
Thank you, Phil. So what I'm going to do now is I'm going to show EMIS Web. So when we've taken our patients as part of the MDT over Teams, I'm going to show how we can then have a look at the record through EMIS Web. So what we've got as part of the list, we've got a couple of patients on that MDT list that Phil showed on Teams. So one of my patients I'm going to pick first is a patient called Eileen Abbott. And what I'm going to do is I'm going to show you Eileen's record. So as part of this MDT, we were going to look through and look at the care plans that we've got in place for diabetes for Eileen. So as part of that demo, I'll show you how to look at the care record. So in EMIS Web, I'm going to go to the care record section using the EMIS ball. And as you can see, you've got all our different parts of the care record. So if I go and have a look at the summary screen, I can see from this page, which is our summary screen, the different problems, any medication, allergies, and so on that's on Eileen's record. So I can see here on the problems list that she's got diabetes. From this summary screen, I've got some views at the top. So if I wanted to look more into that diabetic header, I can narrow down and just look at anything that's relevant on the diabetes screen for this problem, which is what we are going to, let me just minimize that. So what we're going to look at. So I've got all my different graphical views for any findings that have come back and any other relevant coding. So what I've got next, I've got the consultations. So anything, anytime the patient has seen any clinician or within the GP record for diabetes will be in the consultation screen. So I am going to come back to this a little later. So this is just where anytime they've been in or any telephone consultations or home visits. So across to the next tab, we've got medication. So if I wanted to have a look and make sure the patient is on the correct medication for our diabetes, and when we've last had any issues of the medication. So then the next tab, we've got problems. So again, I can see a list of the problems that the patient has. So if there's any other relevance towards this care plan. Investigations. So if I want to see more findings that the patient's had for blood results or any height, weight examinations and so on, I've got my investigation screen. So this has all the coding in the middle section of the screen. So if I was to pick the weight coding, for example, I have down the right hand side any other findings previously with a nice little graph to show how the patient is doing or how the recordings are. So the next tab, we have the care history, which will show and pull in any data for coding. So we've got any codes that have been pulled out from consultations, from investigations that have come back, or any documentation that's come through with the coding. So if I wanted to narrow down and do a text search on anything related to diabetes, I can then, the best screen to look for that is the care history because it will pull them codes in from any part of the record. So here we are. Okay, so I'm just going to close that. On the next tab, I have the diary screen. So on the diary screen, this is where I would view any future recalls. So I can see there I've got diabetic annual review due for the patient next month. Okay. And then I've got any documents that could be relevant. So this would pull in through any third-party products that you may use or any documents that have been saved onto the patient record. And then we have the referrals tab. So if the patient has had any referrals elsewhere to diabetes nurse, etc. So I did say I was going to come back to the consultations tab. So if I just go back there, what I can see here is within the past couple of consultations, I've had a multidisciplinary meeting for this patient. So if I just have a look at this, so I can go and I can either look at it on the screen here or I can just have a look and edit, see if there's any editing needing to be done. But I've got here that the patient's had a multidisciplinary meeting and in attendance with the GP, the nurse, diabetes nurse and an advanced healthcare practitioner. And within this consultation, it was discussed that a care plan has been agreed for the patient across all MDT staff. So please see the care plan modules. So if I just come out of that consultation, that's indicating to me to go and have a look at this care plans tab. So within my care plan, I can see here that a care plan has been created and added onto the patient's record on the 14th of August. It's got a care plan name of diabetes and who it was created by and any modifications. So this is an active care plan that I'm going to have a look at. So what we want to do for this one is review a care plan. There we are. So we've got the details page, as I've just mentioned. So we've got the care plan title of diabetes. It's got the coding behind for diabetes, when it was created, and a review date. So my review date needs changing to, I'll say, to next week. So within this care plan, we have some goals set. So I've got the goal of a diabetes medication review to be done, and this will be to monitor and potentially reduce any medication with any coding behind. To achieve that goal, we have some targets. So we've got reduce insulin dosage, and to do that, we've got some actions. So an action could be to monitor the blood glucose and from some daily 10-minute exercise. So within these, we've had some review dates. So we've got the last reviewed for the monitor blood glucose was the 17th of July, and same again for 10-minute exercise. So if I was to do a new part of review of this care plan, and I want to add a note on, so I've got today's date and the time of the that I'm reviewing the care plan. So if I can now update with something else, so patient. There we are. So now I've added that note, when I come to save my care plan, so you just keep adding to every goal. If I've done something else for each goal, I would just keep adding as I go along. And then when it comes to save and close, this will update with anything that's been reviewed. So you can see now that I've got a new care plan review date and it was last modified today. But if I was to go back to the consultation screen now, you can see that that care plan has been reviewed with today's date. So this is the first patient that I'm going to show. So this is one that's already got a care plan